Mental health resources for veterans are a critical need. Legislation introduced by Delegate Ann Farrell-Tata will focus on creating a suicide prevention coordinator in Virginia. I spoke with a Vietnam veteran who tells me this is long overdue.
Some veterans they feel neglected. They feel like they've been pushed into a corner and say, okay, you've been in the military, that's it.
It's partly why the Joint Leadership Council of Veteran Service Organizations joined with Delegate Ann Farrell-Tata to introduce legislation that will create a coordinator to focus on mental health screenings for those who have served.
Dedicated to providing training, prevention, and really some resources for the service members or veterans and for military families.
In 2019, there were 188 veteran suicides in Virginia. That's according to the most recent report from the U.S. Department of Veterans Affairs.
PTSD and depression, anxiety, but it's real. It's very real, and there's no age limit to it.
Leaders say the legislation comes at a critical time, especially with many people battling with the added stressors of COVID-19. One Vietnam vet talked to us about his mental battles.
The least little thing can trigger my PTSD, and my whole attitude would flip.
Leading Curtis to turn to alcohol.
I never did drugs, and I don't think I ever do drugs, but I try to drink my problems away. I've been locked up so many times in the VA hospital in the mental ward that he put a sign on the door and said, "This is belong to Ron Curtis."
Turning his pain into power, Ron Curtis is now an advocate for service members and veterans battling with mental health crisis and hopes the bill's passage is a priority this legislative session.
I'm happy to help another veteran. If I can get one veteran saved without committing suicide, I feel a lot better.
The legislation passed the House of Delegates earlier this month, and it was referred to a Senate committee last week. In Newport News, Kelsey Jones, News 3.